welcome you on behalf of the Kenya government, on behalf of the Ministry of Health. And therefore, it is an honor and privilege to welcome you all to Nairobi for the 2025 Countdown Country Annual Meeting.
The Countdown Country Annual Meeting have been one of the biggest convening that we've been organizing over the years, actually since 2017. And this is the unique moment where we engage data, where we spend time to go deeper into the data, try to look at progress in the countries, try to see how far we've gone, but also try to see what are those groups that are being left out.
I think it's the first time having an initiative bringing together as many countries as 34 to systematically look at routine data, looking at data generated by countries looking at their own data and making sense out of their own data. So I think the interface between the analysis and generating policy dialogue is quite important. For us, this is what we really rooting for, beginning to utilize routine information, data so generated by countries for action by the countries themselves.
Over the years, Countdown has established a unique network of many institutions at the country level, regional level, across the African continent and other regions of the world, with a focus of generating results to track progress towards the SDG goals for RMNCH. The partnerships that has been established over years is just incredible. And you know that it's not only WHO, APHRC, we have WAHO now, which has got the intense collaboration with the Countdown. And then we also have GFF, Gavi, UNICEF, all of these institutions partnering with the Countdown, but not just partnering in Geneva and in Washington, D.C., but partnering at the country level, which is the most important part. And that Gates Foundation really cares about is the African ownership of this network. And that's a very key element of this unique partnership.
So countries are out of the mode of waiting 3 or 4 or 5 years for an independent survey that is often externally financed and costing a lot of money. And instead, taking action proactively to analyze all available data sources and update their understanding of coverage and equity along the RMNCHN continuum on a regular basis, drawing out insights that they can use for policy and a range of decisions, including how they should prioritize the allocation of their resources, what other changes they need to make within their programs and systems to achieve the best results possible.
During several years, the countries were worried only about national estimates, and the national estimates hide some difference between subgroups. In this workshop, we are working with data from surveys and also from health facility data, and try to understand what are the subgroups that are being left behind, because these groups are more important and need to more targeted policies and need to have more information. So the equity analysis came with this, and then we can analyze through surveys for using different dimensions of inequality, like urban-rural residence, wealth quintiles, and education. And when we are using the HIS2 data, we can try to understand inequality according to geographical regions. It could be provinces, districts, or other health regions that the country have in their data sets.
We're also looking at the institutional mortality, where we're looking at institutional maternal mortality, institutional stillbirth rates, and the institutional neonatal mortality rates before discharge. So countries here managed to look at the quality of the data and the plausibility of these rates, comparing with what's available in the population estimates.
A referir que a nossa participação nas reuniões anuais do Countdown 2030 tem contribuído sobremaneira para melhorar a qualidade das análises e o uso de dados em Moçambique, pois através desta reunião nós adquirimos muitos conhecimentos e também temos usado para a partilha de experiência, assim como para a adoção de boas práticas para a análise e uso de dados para a monitoria das intervenções de saúde.
Et je pense que nous l'avons commencé à travers, en préparant cette rencontre où il y a eu des coachings en virtuel, mais peut-être l'élargir à d'autres compétences pour que ce ne soit pas une ou deux compétences, mais qu'on puisse avoir beaucoup de compétences disponibles dans le pays qui puissent faire le même exercice. Et enfin, c'est la collaboration, le partenariat avec aussi bien les autres pays, mais les autres universités.
The thing I like about the countdown annual country meeting is the aspect of competition that is introduced when you do posters for our countries. Within the annual meetings, as countries put together their reports, countries also put a poster that basically puts the high priority sort of information products or information that they feel needs to be prioritized, and these are then assessed. They are printed and assessed by the facilitators and even the team, the participants, and at the end of the meeting, the posters that are seen to appeal the most or to have the best information or the best messaging are awarded.
We are really proud of the work that has been accomplished over the past few days as part of the Countdown annual meeting. All the countries have done an exceptional work. This year, all of the countries have focused on the health information data. Pretty much almost 95% of the countries have their synthesis report, have their full report, and the result that they can take forward to their countries.
The fact that we're able to build capacity of academics in public institutions and research institutions, and then you're not building their capacity that is abstract, you're building capacity that is linked to evidence generation. And that evidence generation is not academic evidence. It is evidence that actually governments and policymakers can use in concrete terms. But beyond that, you can make connections that don't have impact, but you can actually see real life impact on the ground from the outcomes and the outputs that are coming from this evidence generation. The initiative has produced tools and resources that make it possible for countries to analyze data that has always been there but not always easy to analyze. So that is invaluable. And when you think about the current moment where data systems have been, I would say, defunded and therefore disrupted, being able to have teams on the ground that can access national level data on a regular basis and then use the tools which Countdown has developed and produce results of any kind, I think is really great. I see Countdown playing a critical role in the future of data systems on the continent, specifically by improving the quality of the routine data system like DHIS2, and then of course being able to produce outputs for different parts of government that government can use in decision making.